Hello, and thank you for tuning in to another Tower Health COVID-19 podcast. I'm your guest host, Dr. Wei Du, Senior Vice President, Academic Affairs and Medical Director, Behavioral Health Service Line at Tower Health. I am a psychiatrist by training. It is my pleasure to welcome today's guest, Dr. Eduardo Espiridion, who was on this podcast before and is the chair of Psychiatry Department at Reading Hospital, Tower Health. As you all know, throughout the course of COVID-19 pandemic, there have been many ongoing challenges as situations evolve, new variants continue to emerge, and we see the drastic rise and fall of cases. During all this, many parents feel they're being pulled in too many directions and are looking for help on the best way to navigate moving forward. Dr. Espiridion, thank you for being here today. I'm happy to share that to help prepare for this discussion, local parents in the community shared their questions. We'll be discussing some of those questions today.
Yeah, thank you for having me.
It's our pleasure. So when the COVID virus first arrived, we all found ourselves in a situation we've never been before. So now, 2 years later, parents are still navigating extreme challenges with children having virtual school and needing to quarantine while managing their own work and responsibilities. What tips and suggestions can you provide for parents on how to ask for help in juggling all their responsibilities?
These are hard times. During this coronavirus outbreak, many parents are feeling stressed or worried about a lot of things, from staying healthy, keeping the family well, paying bills, caring for their children who are homebound, keeping kids on task with school assignments, and the list goes on and on. However, I would recommend the following. 1, nurture yourselves. Caring for ourselves helps us to be ready and be able to care for our children and those we love. Number 2, accept your feelings. It's okay to be sad, mad, or scared because of these unprecedented times. Number 3, care for your body. Try to eat healthy, try to exercise. And if you have an ability to do so, get plenty of sleep. Finally, stay connected. Find creative ways to stay socially connected, like writing letters, engaging in online video chats. Also, try to engage in activities like prayer, mindfulness, even a hot shower or reading or listening to music.
Thank you very much, Dr. Espiridion. If I may just to add, stay connected could possibly include stay connected with your children. And the silver lining of pandemic may be that the pandemic gave us an opportunity to connect with our kids, family members, perhaps in a very different way, but could be very meaningful. So thank you again. So what are some ways individuals can better support each other and circulate a message that they are not alone, as you pointed out, staying connected?
Well, during these unprecedented times, connecting with those we love is very important. So we try to find some connections with our community and try to reach out. I mentioned earlier about engaging in phone calls or video chats. This will remind us all of how connected we are to one another. And these are opportunities that will actually stay us connected with people we care about. And ultimately, we try to actually get through this together. That's the overall goal.
Thank you very much. So Dr. Espiridion, here is the very first question from our audience, who happen to be a parent. So this individual asked the following: what are some things that I can do at home that I can control to not make it feel like I'm living in a Groundhog Day movie? Are there any effective and easy self-care tips or ways to switch up my routine? I want to find things to look forward to.
While it's very important to maintain a structure, I would recommend certain activities for you to actually break out from that monotony. Number one is engaging in exercise regimen. This is cathartic for stress, and it gives you a way up of these daily routines. Also, try something new, like for some, engaging in a new activity, like maybe perfecting a baking or cooking technique. For others, engage in activities that they have longed to do, like painting, ceramic activities, or even doing poetry.
Thank you so much. That is great information, and I'm sure that our listener will appreciate it. So here's another question we received. I can't tend to my child needs 24/7 when they're home with me while I'm working. How can I feel less guilty about this? Am I feeling more pressured than I need to be?
Yes, you are likely pressuring yourself, and it triggers some inappropriate guilt. I think you should accept the fact that you can only do so much. And also, I suggest that you ask for help. Maybe your spouse or significant other would chip in, or your immediate family members like your parents, siblings, even your friends would volunteer to help. Don't keep it to yourself. Reach out to other people.
So it sounds like sharing responsibility in a household could be important as we all navigate through multitude challenges, and setting up a boundary could be also important, right? So Dr. Espiridion, here is another question that perhaps everyone will be able to relate to. So the question is, I feel overwhelmed by even the smallest tasks. How can I help myself work through that?
Well, in this situation you mentioned, you may need to motivate yourself by looking at what you have done during this crisis. Maybe reflect on your accomplishments, because this is really a very challenging time. And maybe you're exhausted because you are actually doing a lot more than you are able to. To avoid going to a state of depression, again, try to reach out to the people you love for help. They will understand, because all of you are going through the same situation. Also, if you engage in certain activities that will motivate you further, that will also be very helpful. A simple task like finishing a crossword puzzle will actually accomplish that.
Great suggestion. So I think it is safe to say that any parent feeling anxiety is not alone. What advice do you have for them?
Well, that is true. We can be overwhelmed because you're like human beings reacting to a very stressful situation. Don't keep it to yourself. Being isolated and withdrawn will only get you deeper in despair. Reach out to others. The first thing is to actually reach out to people who are close to you, family members, friends. These are people who are available and may step up to the plate to help you go through this situation. However, there are also other things that are available for you, including support groups that may be available in your local county. These are very important things because they can actually put themselves in your shoes and give you tips on how to cope up with the very situation you're overwhelmed with.
Thank you, Dr. Espiridion. This goes back to your first point, is stay connected. It is important. So my next question is, a lot of individuals struggle to say no when they are feeling overwhelmed. And our next listener asked, how can I say no at home, at work, with my family or friends, and be transparent with my limits? I want to set realistic expectations, but don't want to be viewed that I'm not being a team player. Any comments on that?
Well, I agree that you have to be honest about your limitations. And saying no is just that, being honest. You will be surprised that others are feeling the same way, but are unable to actually express themselves. If you actually go through these activities, you're only going to set yourself to failure. And you will also subject yourself to an unnecessary stressful situation. So my advice is be honest, lay the cards on the table, and express to them that you can only do so much.
Thank you for the advice, Dr. Espiridion. So can you share some tips and suggestions on how our listeners can ask for help in juggling work, home life, and parenting?
Well, I kind of mentioned earlier, there are ways to actually reach out. Again, the best people who will actually give the best help and advice are people who are surrounding you, friends and family members. And if you are unable to actually get enough help from them, just an advice from self-help groups like peer support programs will actually provide that additional help. And I would encourage our audience to actually reach out.
Thank you again, Dr. Espiridion. As you know, that uncertainty creates lots of anxiety. So as we continue to navigate pandemic, one difficulty for families is changing recommendations. So these changes can be hard to explain to our children. So Dr. Espiridion, could you respond to this question from our audience? My daughter loves to go to library and trampoline park, but when we are in the surge, we don't go to many public places anymore. How can I help her understand why we don't go places or see families as often?
You know, it is really hard because kids tend to have that immediate gratification as goals in their activity engagement. However, if you actually explain to the child that we are in this state and express it in a way that they could understand the concepts of infection and safety, and try to actually reinforce this by discussing this on a regular basis, I'm pretty sure it will sink into their mind. Also, to avoid some sort of a stressful reaction from the child, because they tend to actually get angry whenever they are not getting what they want. So try to actually divert their attention into something else. After all, kids love activities, whether it's indoor or outdoor. Maybe at home, you do some other activities like from simple peek-a-boo activities or building a puzzle or engaging in a basketball activity. Those simple things will actually help alleviate that level of stress of a child who won't accept your explanation why they can't engage in certain activities that they want.
Excellent recommendations, Dr. Espiridion. Many parents have concerns about social and emotional impact on their children. One parent asked this question: have there been any developmental or socialization issues that have been identified because of social distancing and masking? What can I do to help my child grow in these areas where they continue to wear masks and aren't able to interact with other children as they normally do?
You know, this is really quite impactful currently. You know, some of the kids can't really understand why they can't engage in certain activities, especially those who were able to engage with their classmates or those who went to classes without any mask. I think it is a dual effort from the parents as well as the school authorities to explain to the child that these are issues that needs to be adhered to. And also, this is hard though, because, you know, around the early preschool age or during elementary stages, socialization is a big part of our growth and development. And I personally think that will hamper our ability to actually interact. However, there are other ways you could still interact, like cameras or videos or other forms of activities that doesn't require some sort of a physical contact. But I agree with this parent because I personally feel that the social growth may be impacted by this. Fortunately, the states are starting to actually remove the mask mandates, and hopefully we'll go back to the normal as soon as possible.
Well, thank you again, Dr. Espiridion. So you have provided a lot of great information for our listeners. And as we close, can you please share some options for parents who continue to feel sad or anxious?
Well, if you are a parent who continues to feel depressed and anxious, don't keep it to yourself. Please seek for help. It's a lot easier to handle them when they are in the early stages. So if you are feeling overwhelmed and depressed or anxious, seek help. Reading Hospital Behavioral Health is accepting new patients. We offer both in-person and telehealth options in our outpatient setting. You may call area code 484-628-8070 and schedule an appointment. If you or someone you know needs immediate help, please call 911. Tower Behavioral Health also has a crisis number at area code 888-905-0809. Our Berks County Mental Health Crisis Intervention and Emergency Services has a hotline. And please call area code 877-236-4600 or text "Are you okay?" to area code 484-816 "Are you okay?" or 7865 right away.
Thank you, Dr. Espiridion, for sharing all those critical, important resources and information. I think our listeners will very much appreciate it. So thank you for joining me, our listener, and Dr. Espiridion. Thank you for the wonderful recommendation and suggestions. To our listeners, be well. After our discussion today, I hope you know you're not alone and help and resources are available in the community. See you next time.